Are you tired of endless nights of interrupted sleep due to the snoring during your pregnancy? Well, today I have some incredible tips and tricks that will help you to put an end to these snoring woes. You won't believe how simple and effective these solutions can be. So, if you're ready to reclaim your peaceful sleep, keep watching. But before we dive into this solution, let's quickly understand why snoring becomes such a common issue during pregnancy. The main culprit behind the annoying snoring is the hormonal changes and increased blood volume that occurs in your body. These factors can lead to nasal congestion, which in turn causes snoring. Now that we know the causes, let's jump right into the solution. Solution 1. Sleep positioning. Did you know that changing your sleep position can significantly reduce snoring? Try sleeping on your side instead of your back. When you lie on your back, the weight of your uterus presses against the blood vessels, causing congestion in your nasal passages and leading to snoring. Sleeping on your side, particularly the left side, can help relieve the pressure and promote better airflow. Solution 2. Nasal strip. Nasal strips are adhesive strips that you apply to the outside of your nose. They work by gently lifting your nostril and widening the nasal passages, allowing for improved airflow. Nasal strip can provide temporary relief from snoring and help you breathe more easily during the night. They are safe to use during pregnancy and can be easily found at your local pharmacy. Solution 3. Humidifier. Using a humidifier in your bedroom can work wonders in reducing snoring. Pregnancy hormone can cause the lining of your nasal passages to swell and become congested, leading to snoring. A humidifier adds moisture to the air, helping to keep your nasal passages moist and reducing congestion. Make sure to clean your humidifier regularly to avoid any potential bacteria buildup. Solution 4. Elevate your head. Raising the upper half of your body slightly can help alleviate snoring during pregnancy. You can achieve this by using extra pillows to prop yourself up or investing in a pregnancy pillow designed to provide support and elevation. By keeping your head and upper body elevated, you reduce the pressure on your airways and improve airflow, minimizing snoring. Solution 5. Stay hydrated. Drinking plenty of water throughout the day is essential for your overall health during pregnancy, and it can also help with snoring. Staying hydrated thins the mucus in your nasal passages, reducing the congestion and making it easier to breathe. Aim to drink at least 8 glasses of water each day to keep you well hydrated. Solution 6. Nasal saline spray. Using a nasal saline spray can provide relief from snoring by clearing out the nasal passages. During pregnancy, your nasal passages can become congested during the increased blood flow and hormonal changes. Nasal saline spray help moisturize and flush out mucus, reducing congestion and improving airflow. Opt for saline spray specifically designed for pregnant women and follow the instruction for safe and effective use. Solution 7. Maintain a healthy weight. Maintaining a healthy weight during pregnancy can contribute to reducing snoring. Excess weight gain can lead to the narrowing of the airways, making breathing more difficult and increasing the likelihood of snoring. Follow a balanced and nutritious diet recommended by your healthcare provider and engage in gentle exercise suitable for pregnancy, such as walking or prenatal yoga. By managing your weight, you can alleviate snoring and promote better overall health. Solution 8. Seek professional help. If your snoring persists despite trying this solution, it's important to consult a healthcare professional. They can evaluate your condition and provide additional guidance tailored to your specific need. They may recommend further intervention such as continuous positive airways pressure, that's CPAP therapy, or other specialized treatment. Remember, seeking professional help is crucial to ensure your well-being and address any underlying causes of snoring. Now that you are armed with these fantastic solutions, you can finally bid farewell to those restless nights of snoring during pregnancy. Remember, it's crucial to consult with your healthcare provider if your snoring persists or worsens, as they can provide personalized advice and guidance. If you found these tips helpful, be sure to give this video a thumbs up and subscribe to our channel for more valuable content. Share this video with other pregnant women who may be struggling with snoring, and let's support each other in getting a good night's sleep. Thank you so much for watching, and I will see you in the next video.